We can go ahead and get started, and we'll just let people trickle in as they come. As I said, my name is Dakota Jablon, and I am the Suicide Prevention Specialist at the Educational Fund to Stop Gun Violence. And we are a 501c3 organization, and we really look at gun violence through the public health perspective. So that is the perspective that I'm going to give to you today. But I want to be super clear just from the start that I am not here to vilify gun owners, to say that we need to get rid of all guns in society or in Wyoming. I very much respect the Second Amendment. I respect that there are gun owners. One of my best friends is a gun owner. So this is not coming across at all, or I hope that is not, I hope in your perspective, it's not coming across at all that this is, an anti-gunner presentation. This is really coming at a place from injury prevention and suicide prevention and taking that public health approach to suicide prevention, which I'm going to show to you today involves addressing access to firearms. So I'm going to go ahead and share my screen now. And so this is my present. Hopefully, can people see? Hopefully, okay. This, because I can't see the chat box at the same time, but if people come unmute, let me know if you can't see anything. But this is, like I said, looking at the intersection of firearms and suicide. So right off the bat, I want to talk a little bit about how this is part of a public health approach to suicide prevention. So this is the CDC's approach to preventing suicide. I linked at the bottom to, it's their technical package. And as you can see, there are multiple strategies and different approaches that go within each strategy. So the third strategy down is create protective environments. And I have highlighted reduce access to lethal means amongst persons at risk of suicide. So this is an evidence-based strategy that is supported by the CDC, and there's a way to do it that, again, isn't coming across as just a gun grab, but there's a way to do it through that injury prevention model. I'm sure many of you are also familiar with this. It's the 5 action steps for helping someone that is in emotional pain or may be experiencing suicidality. And as you can see, again, the second step after asking, are you thinking about attempting suicide or thinking about killing yourself? The second question is, the second step is to keep them safe, which is reduce access to lethal items or places until that risk subsides. So this is a model of, oh, I think we have a few people not on mute.
You're crazy.
I don't know if I know how to mute everyone, but if people could put themselves on mute, so.
Oh my gosh.
Thank you. Okay, so I saw this in a presentation and I thought it was really compelling, and so it is the courtesy of Jeff Swanson, who is from the Duke University School of Medicine. So when we think about suicide, we often think just about the deaths. And so this is a picture of an iceberg. So at the top of the iceberg is the suicide deaths, the people that are actually dying by suicide. But we know that that's just the tip of the iceberg. Underneath is the millions of people who either considered suicide. It's estimated 9.8 million adults seriously consider suicide annually. Annually, more than 1 million people attempt suicide. And then, of course, there are people who feel hopelessness, that engaging in risky alcohol use, which are all risk factors for suicide. But at the top of it is the people who actually die. So similar in a different way to see it is, this is from SAMHSA and NIMH. That shows, oh, could people put themselves on mute? Thank you. So this is kind of the universe of suicide within the past year. So there's all the people that have seriously considered suicide, then there's less people who actually made plans, even less people who attempted suicide, and then there'll be even less people, as you saw in the iceberg, that actually die from suicide. And so from a suicide prevention model, all of these people are important to reach, right? We want to prevent someone from ever even becoming suicidal. But we also need to make sure that someone, if they are considering suicide, that they don't actually die from that attempt. So it's super important to obviously think about the why, but for today's presentation, I'm talking about the how of how do people die by suicide. So going back to the model with the iceberg, as you can see, it has now been flipped. And that's because when a firearm is involved, the model it flips because they are the most lethal suicide attempt method in the United States. So when someone attempts suicide, normally there's a huge chance that they will survive, which we saw back here with all of annually more than 1 million attempts. You see this right here, 1.3 million adults attempted suicide. But when it comes to with a firearm involved, they are going to die 9 out of 10 times. And so that's why paying attention to that means in which someone attempts suicide is so important. So this is from the CDC on what risk factors are for suicide. And a lot of people, and this was actually my perception when I first started getting involved in suicide prevention work, was that we needed to just focus on mental illness. And while mental illness is a risk factor for suicide, there are many other risk factors for suicide. And as I'm sure all of you know, there isn't one cause of suicide, but there are all various factors that can increase someone's risk for suicide. And one of those is easy access to lethal means. And so when you look at all of these things that are risk factors for suicide, but the one thing that stands out with the lethal means, in addition to it being in yellow, is that it's easily modifiable. So it's hard to help someone in a short period of time with physical illness or the stigma or hopelessness. And that doesn't mean that we shouldn't be focusing on that as well. But if we want to prevent suicide at the population level in the fastest time, we also need to pay attention to those lethal means because it's very modifiable. And access to a gun in the home increases the odds of suicide more than 3-fold. So we know that just helping to reduce access to a gun during a period of suicidal crisis really can save a life. And this model, the 3-step theory of suicide, really outlines that. So the first step, and it kind of shows how someone can get from thinking about suicide or experiencing suicidality to actually going through with the attempt. So are you in pain and hopeless? That will make you have a suicidal ideation. Is your pain greater than your connectedness? That leads to a strong suicidal ideation. And then are you capable of attempting suicide? And that is when the access to lethal means, including guns, comes into play. So it's not that, and I want to be very clear, it's not that owning a gun makes someone suicidal, or that people who own guns are more suicidal than people who don't have guns. It's that having access to a gun increases the capability for someone to attempt suicide, which makes it more likely that a suicide attempt is lethal and that person will actually die from their suicide attempt. And there are some other, factors that come into play, specifically with veterans. They are potentially less afraid of death. They are very knowledgeable when it comes to firearms. The same thing with law enforcement. Law enforcement have an increased risk of suicide and especially firearm suicide. And it's because they're very capable with a firearm. And that is different with someone who maybe doesn't have access to a firearm and they're going to use a different method that is more comfortable to them and that they are more experienced with. Because when you're in that period of pain and hopelessness, you're not thinking, oh, well, I'll just learn how to use this new tool so I can get to that end result of dying. You're using what is most available and what you're most comfortable with. So as I've mentioned, suicide attempt outcomes are related to the chosen means, and firearms are the most lethal method in the United States. And I was very shocked to learn this when, again, I first got into suicide prevention, that the most commonly used suicide attempt methods in the US are cutting and piercing and overdose, and those are fatal less than 3% of the time. Another thing that I always get a lot of questions about, and I think there's a lot of misunderstanding around this, is that means substitution is uncommon. So people say, oh, well, if you just reduce their access to firearms, they'll find another way with a different method. And they've actually found that that isn't true. And they found also, which I think is interesting, that 9 in 10 attempt survivors do not go on to later die by suicide, and 70% never attempt again. And I think that's really important. And I'll just share very quickly my own personal story. I myself am a suicide attempt survivor back when I was in high school, which is over 10 years ago now. And I fall into this 70% category, that I was able to luckily get the help I needed. I attempted with a very unlethal method, and I was able to survive that attempt, get the help I needed, and I'm here talking to you all today. And I'm in that category that never attempted again. So we know that placing time and space between at-risk individuals and firearms is increasingly being recognized as a crucial suicide prevention strategy and a firearm suicide prevention strategy. This is another conceptual model that was developed out of Harvard, and it kind of shows how reducing access to these lethal means can make the suicide rate at the national or state level drop. And so again, I mentioned that substitution is uncommon, but even if it does happen, when other methods are far less lethal, it is more likely that someone will actually survive that attempt and that that crisis will pass. And then again, leading to that suicide rate dropping. Similarly, by making a firearm or that lethal means less accessible, an attempt can be temporarily or permanently delayed. And again, most people do not go on to attempt or die by suicide. So before I go on, I just wanted to quickly kind of recap that on why we need to focus on the how. And these are kind of what I think are the main summarizing points. Something that I hadn't mentioned, but I wanted to say here, is that people who die by firearm suicide are actually less likely to seek mental health care, disclose suicidal ideation, and engage in a non-lethal prior suicide attempt. So that's why it's so important to kind of go out of that mental health model, because most of this population who's attempting suicide with a firearm and dying aren't known to the mental health care system. We also need to focus on the capability for suicide because it's so difficult to detect suicidal desire. And we definitely need to do the universal prevention and make sure that, we're having people, all make a living wage and that everyone has a home and various things like that, which will prevent suicide as well. But it's hard to know in a group of people which person is actually maybe considering suicide and which person is actually going to go through with that attempt. And that's why the means safety, means matter is really important. Focusing on the how is a public health approach that can be better applied to the entire population. We've seen that with many other examples, one of which is, we don't let your friends drive drunk, and that has changed motor vehicle accidents, definitely within my lifetime. And that's because we focused on the how are people dying. We weren't talking about, making sure that they also aren't drinking to excess, which is important. But if we wanted to prevent those motor vehicle accidents, we also needed to focus on the how. Also, periods of acute suicidal crises are brief. They can often be as little as minutes up to just an hour. So there is a very short time frame. Easy access to lethal means is the strongest determinant of what the attempt outcome will be. So if someone will survive or not. And then again, additional suicide attempts are unlikely if the suicidal crisis is survived. So now I wanted to go into some statistics specific to Wyoming. So this is the average from 2014 to 2018, looking at suicide attempts by method, both in the United States and in Wyoming. So in the US overall, about half of all suicides are by firearm. But in Wyoming, it's about 2/3 that are actually by firearm. And that is one of the reasons that Wyoming has one of the highest suicide rates. And Wyoming actually has the highest firearm suicide rate in 2018. And it's because in other places where there might be less firearms available, that means that people are attempting with those less lethal methods. So this shows the rate of firearm suicide in Wyoming and the United States. So as you can see, it has been increasing both in the United States and in Wyoming. Wyoming's is a little bit different just because there's obviously a much smaller population. So even 3 additional suicide deaths or 3 less suicide deaths in a year can more affect what the rate is. But as you can see, within the last 10 years, the firearm suicide rate in Wyoming has always been at least double what the US's rate is. So looking at in Wyoming, who is the most at risk for dying by firearm suicide? It is mostly men. There are obviously some female, 16%. And looking at the range of ages, you can see that actually across the age range, all of the ages really are at an elevated risk. And this is especially looking at even neighboring states where the rate will be, you know, a much lower in the earlier ages because they're less likely to use a lethal means. But in Wyoming, it's a heightened rate across the population. But the highest rate is in the 75 years and older age range. This is by county, as you can see, and I will share a resource at the end. This is from a website that I actually helped lead the development of, which is called preventfirearmsuicide.com. And this is on the website an interactive map, so you can actually hover what the county is to see what the actual rate is. But as you can see, even the county with the lowest rate is still 9.94, where in other states, you know, the lowest rate could be as low as like 2 per 100,000, whereas this is 9.94 per 100,000. I also wanted to briefly mention the intersection of alcohol use and firearm suicide that I think often really gets maybe forgotten in the larger suicide prevention conversation. But alcohol use is a risk factor for suicide, and it's even more so when a firearm is involved. And one of the reasons why is because people often use alcohol to decrease their inhibitions, which makes it, you know, if you're afraid to actually go through with attempting suicide and you're afraid of pain or whatever reason, your inhibitions are lowered by drinking. And, you know, I can even say for myself, when I'm struggling, not necessarily now, luckily, with suicidality, but if I'm having a hard day, I know myself and through years of therapy that I probably shouldn't drink because that'll just make me go in a tailspin. And this is exactly why. And the reason I really wanted to highlight this is because for a total separate project, I was looking at alcohol use across the country, and I saw that in 2017, Wyoming was rated as, this according to the CDC, the state with the highest rate of binge drinking. And it said that the total number of binge drinks in 2017 by people who binge drink was highest in Wyoming, with someone consuming more than 1,200 drinks in a given year. Additionally, an analysis of the National Violent Death Reporting System in 18 states, which I know at the time did not include Wyoming, but they found that alcohol use before death was more likely to be associated with American Indian, Alaskan Natives, their suicide attempts, more often than white, non-Hispanic decedents. And I think that's really important because I know in Wyoming, there is also a large Native population. And so when that population is also at increased risk for having that alcohol use, it's really important when thinking about prevention. And that kind of leads into right now with COVID-19 and suicide prevention. So I don't know if folks have seen, I think this came out 1 or 2 weeks ago, a new survey that the CDC did that surveyed US adults 18 years and older, how they're kind of coping with COVID-19 and their mental health. And this isn't in this graphic, but what they found also, which is very alarming, is that 1 in 4 young adults, I believe it was 18 to 25-year-olds, 1 in 4 had seriously considered suicide within the past 30 days. Overall, that was 11%, but again, that younger age, 1 in 4, So we're seeing an increase in suicidal thoughts right now. We're also seeing an increase in substance and alcohol use. And this is again, the increase in depression symptoms. You know, this is a hard time. I'm personally working at home right now. I haven't seen my family in months. It's, you know, everyone is struggling. We all have to kind of hopefully come together, but we also need to know how to keep our friends and loved ones safe. And this shows of the various risk factors that are increasing right now with COVID-19. And the reason that this is really important when it comes to firearm suicide prevention is that many people are working from home, spending more time at home as we try to mitigate the risk of the spread of the virus. And so people who are experiencing these increased risk factors at the same time that they are now spending more time at home with their firearm, potentially drinking, you know, potentially in that spiral. And when you have that firearm, having that easy access to it, it can make that suicidal ideation actually become a suicide death. So I'm now going to go into, and I'm definitely leaving, looking at the time, I definitely am going to leave time at the end to ask questions because I know I'm throwing a ton out there and I don't know how familiar people are with firearm suicide prevention. But these are the strategies that I want to talk a little bit about when it comes to suicide prevention. And I know that you, or many of you probably were just on the CALM training previously, which is the lethal means safety counseling. So I won't go into too much detail with that. But at the beginning, kind of what everyone personally can do and what people can talk to their loved ones, their friends, their patients about is practicing safer storage. And so what does that mean? There's kind of various levels of what safer storage can be. So you should store your firearms unloaded and locked. The ammunition should be stored separately from the firearms. You want to ensure that the key and or combination is inaccessible to the person who is in that suicidal crisis. And you may want to consider temporarily removing those firearms from your home. And so if you are interested in temporarily removing firearms from your home, depending on the jurisdiction, you can give your firearms to a family or friend to hold on to while you're, you know, struggling a bit. You can temporarily transfer your firearms to local law enforcement. Obviously call the local law enforcement ahead of time. I know that, again, it's different jurisdictions if they will accept it or not, but in a lot of places they will. And similarly, a lot of gun stores and firearm dealers will also store your guns if you call them ahead of time. Again, every store is different, so call ahead of time. But with this, I just want to say, again, give a personal example of why the safer storage is so important and why I think that it's one of the most important things that we can do, because I think what is great about this is that if you talk to someone who is suicidal, or even before they get to that point, but you're afraid that they're not maybe having the best time right now, if you talk to them, my experience, in a loving and compassionate way, and coming from that injury prevention, wanting to keep them safe, and about how this is within their rights to voluntarily do this. This is not with law enforcement. It's making sure that they have ownership to do something. In my experience, it's actually gone really well. And so I want to quickly say, one of my good friends is a gun owner, as I mentioned, and she had just been having a bit of a struggle. She wasn't doing so great. Didn't think that she actually was suicidal, but it still was, there was something, you know, I do this for a living, so I was, you know, slightly concerned. And I knew that she had a gun and that she had easy access to it, and that she could easily have used that in a period of time in which maybe she was drinking. And so I was just nervous of what could happen. And I was struggling, like, how would I have this conversation? And I, said, you know what, I'm coming out of a place of love. This isn't me criticizing her for having the gun. This is me just trying to hopefully potentially save her life. So I ended up giving her a call and I, said, this is a really awkward thing, but I've been kind of nervous about you. I know you're not having the best time right now. You're kind of going through a few things. And I think that you might want to consider letting your friends or giving your gun to your parents, someone else to hold on to it right now, because I just don't know if that's something that you should have in easy access while you're not going through the best time right now and you're not in the best mindset. And I think, you know, in a few weeks or a month, you can get it back. And she actually said, which I think is very meaningful to me, is she's like, actually, I've been thinking a lot about the work that you do, and I actually got rid of it 2 weeks ago. And so you know, that conversation that I was so nervous to have with her, she had actually heard me talking about this, not to her, but just generally about why gun safety is important as a gun owner, because she's from the Midwest, a huge gun owning community. And, you know, I never criticize her for that. I've shot guns with her. I've been to the farm. I've, you know, been trained by her brother. But I've talked to her so much about this, the fact that she already knew to do that and that she did it on her own, it made me really proud of her. And it also just showed how having that simple conversation with someone really can save a life. So I also want to share, there's this amazing website that was developed out of Colorado called Lock to Live with the number 2. And it also, they actually worked with gun owners the Colorado Gun Safety Collaboration or something along those lines. They developed this amazing tool that someone can kind of walk through to develop what is the best plan for them. Is it locking it in their home? Is it giving it to someone else? Is it freezing the key? I've heard about that, people freezing the key to the gun safe. And so by the time that it melts, if you really want to get your gun, then you have that kind of time to subside. So this creates, again, something that someone can do on their own to help them decide how they want to voluntarily kind of reduce their access to a firearm during a period of suicidal crisis. There's also a new website that's called HoldMyGuns.org, and it is not fully developed yet. I just checked today because it said it was going to be fully more so released in the fall, but they are creating kind of a national map, I believe, or I think that's their plan, of gun shops and FFLs who are willing to hold someone's guns during someone's, you know, suicidal crisis, or for no other reason. Maybe they're moving or they're Airbnb-ing their home and they want, you know, to have someone store their guns outside of their home. So this is going to be a website hopefully available. The website's up now, but hopefully the map will be available this fall. And so actually some states have created their own maps. So Colorado was the first one to do this. And I believe Maryland and Washington have now followed suit, but they have an amazing interactive map where you can go on it. You can see the blue in the map represents where police will voluntarily store your guns. The red, I believe, are the FFLs or gun ranges. I'm not sure what the yellow means, but if you go to this website, you can kind of see exactly how they promote this really, I think, amazing tool. And again, it's going to help can someone voluntarily do this on their own. And so generally, you know, even without the map, if people want to store their guns outside the home, you can contact your local gun shop, shooting range, police department, obviously call ahead of time because every place is different. You can also potentially loan your gun to a relative as long as that person isn't prohibited from having a gun in the first place. Also, always check with the local law. And before you take your gun anywhere, even if they say, you know, that they accept it, you want to ask what the process is, if there's costs, if a background check is going to happen, what the limits are on how long it can be. So you want to have that conversation ahead of time. But again, I think this is a really great tool for someone who might be experiencing suicidality that even just for a week wants to get the gun outside of their home. This is kind of just a graphic of the lethal means safety counseling, which is the process that healthcare providers can work with their patients in a collaborative manner to find what the best solution is, again, for creating a safety plan, which involves addressing access to lethal means like a firearm and reducing their access to that firearm until the risk subsides. So these are considered the 5 L's. Is it locked? Is it loaded? Are there little children present? Or is the operator feeling low? Is the operator learned about firearm safety? Next, there are some things called the Gunshot Projects, and this was developed actually out of New Hampshire, but it's really now been expanded through a partnership between the American Foundation for Suicide Prevention and the National Shooting Sports Foundation. So they have created a ton of amazing resources that can be used at gun shops, gun retailers, firearm ranges, or just generally with a gun owning population, to talk about suicide, what the risks are. Again, I think they did a really good job of making it about injury prevention, but not stigmatizing people, but very much coming from that saving lives place. So if you go to afsp.org/firearms, they have a ton of different resources. As I mentioned at the beginning, or a few slides ago, there's also, of course, laws that come into place. And every state is different when it comes to what laws exist when it comes to guns, as well as at the national level. And as I said, when I first started, I'm not talking about, getting rid of the Second Amendment or taking everyone's guns. That is not what I'm here to say. But I did want to let people know that something, as you can probably imagine, I'm very passionate about suicide prevention. And so in addition to our suicide prevention work that I really try to lead, I also do our federal affairs. And one of the things that I do when I'm talking to legislators in Congress or even talking to fellow groups is I want to make sure that suicide prevention is being talked about and is being considered when different policies are brought to the table. So one of the things that gets talked about a lot is universal background checks. And so when this policy was brought to Congress back when this recent session had started, which was almost 2 years ago now, when I first looked at the bill, I said, we need to make sure that, if background checks come in place across the country with universal background checks, that I want to make sure that someone isn't breaking the law if they need to loan their gun to a friend because they're suicidal right now. And there needs to be a specific exception for that to happen. And so that was our recommendation. And I'm happy to say that that was included in the bill that did pass the House of Representatives. It hasn't, and nothing's ever happened to it on the Senate level. I don't think anything will happen this year. But even though I know that Wyoming doesn't have that many gun laws on the books, I just wanted to let people know that even when it comes to the federal space, that at least I'm really thinking about this, of how can laws actually prevent suicides and making sure that there's not these unintended consequences that, someone breaks the law because they are trying to save a life. So I just wanted to kind of, that's not the main part of my presentation, but I wanted to kind of give that background and say, if people are interested in this topic, to make sure that background checks, a state or a federal law, there should be that specific exemption. I think I mentioned this earlier. I'm kind of getting into the resources now, and then I'm happy to answer questions. But I believe it's exactly a year ago now. Wow, where does the time go? But I developed with my organization this website called preventfirearmsuicide.com. And there's a ton of statistics, a lot of reports and information. We have a veterans section. We have a section on COVID-19 and firearm suicide, on safer storage. And we tried to make it a very one-stop shop for firearm suicide prevention. And so every page of the website has a ton of resources. I have a public health background and I love research. So every page also has basically all of the research that's available on these topics. But I hope that that can also be a tool for everyone, as well as it has the state level statistics on firearm suicide. This is, again, I mentioned the COVID-19 firearm suicide intersection that I wrote a report on and talked about. In addition to reducing access to firearms potentially during this time, various things like calling your neighbor, making sure that they're doing okay, maybe getting groceries for them if they're elderly and shouldn't be going outside. Also making sure that there's robust unemployment benefits, that will help reduce suicide. So it talks about firearms, but it also is this very much public health approach to suicide prevention. Again, I was going through some quick resources, and I can send out this presentation also. If Lindsay, you're on this, I can send it to you after, so people have kind of all of these resources. But Lock to Live is what I mentioned earlier. The Project Child Safe is the National Shooting Sports Foundation's program. The Safe Firearms Storage Program is the National Crime Prevention Council. They're all somewhat similar, but all about how to practice safer firearms. And I think I chose these 4 ones because I think they do a really good job of, again, not being critical or too in your face about the guns aspect, but really coming from that injury prevention model. You might have gotten some of these also from the COM training if you were on that earlier, but here are some resources for lethal means safety counseling. If you're a healthcare provider, the What You Can Do initiative out of UC Davis, I think is really great, and they worked with gun owners on that. There's a new thing coming out from actually the similar team called the Bullet Point Project, and they are researching, developing, implementing, and evaluating training programs to see what really will prevent suicide. And then I think that what the Defense Suicide Prevention Office and the VA has done has also been really good. And so some of these are presentations and handouts, but I think that they also do a really good job of kind of weaving the needle of people who, you know, are gun owners and want to just be safe. Some links to community projects and partnerships. As I mentioned, the Colorado gun storage map, I just think it's really great. So I wanted to flag that for folks. Here's some of the information with AFSP and NSSF. And then also the Utah Suicide Prevention Coalition. They, I guess, have a conceal carry training module on firearm suicide prevention that I think is really great also. And I believe that it's part of the process of someone actually getting their concealed carry license. So this is my contact information. As I said, I'm the suicide prevention specialist at the Educational Fund to Stop Gun Violence. This is my email, and let's see what time it is. About 3:40, so I'm happy to answer. I tried to go a little quickly, but I might have gone too fast. But I'm happy to answer questions if folks have any. Oh, I already see there's been 2. Let's see. Does anyone, oh, this is just saying I can see the presentation. Does anyone have any questions? We can either enter them into the chat, or if people want to take themselves off mute and ask, I'm happy to do any of those. I don't think there's any question. Oh, do you know about the Title 25? Oh, I'm going to type in my email address because this will be easier. That's my email. Do you know about Title 25 holds? If a person is put on a hold, do they get their guns taken away? So I'm assuming that the 25 is specific to Wyoming. So I'm unfortunately not super familiar with Wyoming law, but I can talk about other states. And so I'm assuming it might be different depending on the state. So for federal law, if you've been involuntary committed, that is when your gun rights are taken away. That was developed though in 1960 when there was a period of people being institutionalized for like their entire life. So there actually aren't as many people getting their gun rights taken away forever through that because, so I'm from California originally, and we have, it's called the 5150, and that's a 72-hour hold. So nationally, sorry, there's fuzz flying. Nationally, at the federal level, you wouldn't necessarily have your gun rights removed for that purpose. In California, there is the Title 20, the 72-hour hold. So I can look into this. I don't know the answer specific to Wyoming. In California, the same thing of the 72-hour hold is that you do have your gun rights taken away. I believe it is for 5 years. I could be wrong. I haven't lived in California in a while. But every state is different with how long someone's guns will actually be removed. I know that there's actually, which if folks are, I don't know if people are researchy or interested in that, but there was actually a study that just was released yesterday that talked about how it worked in Florida. It's called the Baker Act there. And I think theirs might have been longer than 5 years. But what they found is that, you know, people who have been involuntary committed, even for the 72-hour hold, they're at an increased risk of violence, specifically towards themselves. And so from our organization's perspective, and other groups may be different, right? So I'm just speaking for our organization's behalf, coming from very much that public health model, is that we don't think that your gun rights, even if it is a 72-hour hold, we think that, we know risk fluctuates over time. And so we think that you shouldn't have your gun rights removed for the duration of your life, but it should be based on that actual risk. And so perfect, someone just sent this. So from our perspective is that, if there is that 72-hour hold, our recommendation, I believe, is 5 years, that you would have those guns, that you wouldn't be able to purchase or possess a gun for those 5 years after that 72-hour hold. With the option, which I think is really important that people also often forget about, is that, and again, this is our perspective, is that there should be a petition that you can get your gun rights, petition to get them back in that period if you feel like your risk has subsided. So we've worked on laws that it's called the Extreme Risk Protection Order, the red flag law. There's a lot of concerns about it. I know it gets talked about in the news a lot, but one of the things that we have worked on when we work on that is making sure, and that's just for a 1-year hold, that you can't purchase or possess a gun. But even in that 1 year, your risk may decrease over that time. And so making sure that if someone wants to have their gun rights reinstated, that they can petition to have them given back during that time. But I'm sorry, I don't know the answer specifically to Wyoming, but it may be similar to California's, that it's time limited, but I'm just not sure. Hopefully that somewhat answers the question. A long-winded answer. Does anyone else have any questions? Not seeing any. If anyone wants me to go into more detail about anything, also happy to do that. I know we have the full hour, so happy to give people their 15 minutes back, or go into kind of more discussion on something if that would be helpful at all. I'm not seeing anything. I guess I can defer to you, Lindsay, if you're on here somewhere. I think you are. Oh, okay, perfect. If I should keep talking about something or just let people go, I don't know what the best strategy is. I thought I would have taken the full hour, but I guess I talk a little fast.
Hey, Dakota.
Hey.
So I was wondering, could you talk a little bit about the effectiveness of gun locks versus, I guess, having another place to store a firearm? I feel like I hear a lot of times from law enforcement that they don't feel like people use the gun locks very often. Do you have any thoughts about that?
Sorry, can you repeat the question? You're breaking up just a little bit. I don't know if it's my computer. Let me turn it on.
Gun locks versus storage.
So I think from my perspective is that it's kind of, and again, this is my perspective of thinking that the person really should be involved in the process, if possible, obviously the safest thing if someone is in an acute suicidal risk is storing the gun outside the home, just because then that means that they don't have access at all. Otherwise, I think what is the medical professionals recommend is kind of, then the next best thing would be kind of doing everything. And so actually storing it in a safe, but then also kind of disassembling the gun or using a trigger lock. But kind of from my perspective, and again, it's that injury prevention model, is anything is better than nothing. So there's the different levels of how comfortable someone feels. And so I think, it is, especially, I've never been to Wyoming, but having spent some time in the Midwest, I'm very much respect that guns are a big part of someone's culture. And so you also want to like respect that, and so I think in my dream scenario would be if someone was suicidal, people are able to have the conversation like I had with my friend. And so like I was able to have that conversation with her before it even got to that acute suicidal crisis. It was more when she was experiencing those risk factors. And then she luckily was willing to kind of take that step to just get rid of them altogether. She has them back now. But at that period of time, I don't know if that's exactly answered your question, but I personally think part of it is working with that person.
No, I think that's a great answer. Thank you.
Okay.
Yeah, I was at a conference, I want to say 2 years ago, and someone was presenting on this, and he works with veterans, and he said there was just one veteran, like, that said, he's like, I will not let you take my firearms out of my house. And so he said, well, can we lock them up in a gun safe? And he said, yeah. And then he had him put the key into a milk jug filled with water and put that in the freezer. So
yeah, I had heard about that too. That I think I heard about that at a conference I went to that was on veterans, and it's real. I mean, if that's what people feel comfortable with, like that works also.
Yeah.
So I think it's definitely, again, like if you're a doctor or a clinician working with your patient, if it's just you with a friend, like working with them and getting to that place that you can have a very, like, again, that I had with my friend, a very open, honest conversation and getting to the point of what do they feel comfortable with. And I think when you can get to that point with, especially coming from like a place of love and respect, I think you can get to in my perspective and my, one example, it came to a good place. Oh, someone said something. Oh my gosh, I'm so sorry to hear that. Yeah, I don't know if I said this at the beginning because I've said a lot today, but I think something that I've realized also that is I think when it comes to suicide prevention, and this is what actually led me to want to work in gun violence prevention. So just a little bit of more background about me. I wanted to do specifically suicide prevention policy. And when I went and got my master's, I'm from California. I attempted suicide not with a gun. So that was, they just weren't in my knowledge of thinking that was part of the solution. And it was when I got my master's that I learned that guns were the most lethal method and that using them or preventing access to guns during just a short period of time really can make a difference. And I kept thinking, why aren't people talking about this then? Like, I know gun owners will do that. I don't think they know this. Even my parents are gun owners. They did not know that even when I was suicidal when I was younger. Luckily, I didn't even know that they did have guns, so they were locked away. But I think that's what really led me to this kind of specific area of suicide prevention is I think once you talk to people and kind of share that information, and it's just awareness, because I think people just don't know that how important that is to actually reduce their access and remove guns even for a short period of time. And that really can save a life. And it's just part of being, a safe gun owner and a responsible gun owner. And it's not about, quote, gun control or getting rid of the Second Amendment. It's just about a place of injury prevention and suicide prevention. And yeah, I think that, Nate, your story, I mean, it's heartbreaking. And I think there's so many lives that really could have been saved if people were just a little bit more aware of everything. Do you have data on if suicides? So I think I've said this. I love data as a public health person and have a bit of a research background. And probably my biggest frustration when it comes to suicide prevention is that the most recent national data we have is from 2018, which is not exactly helpful when it is 2020 and we're in the middle of a pandemic. So I actually just saw that Australia has already come out with their numbers on suicide within the pandemic. And so they are able to count that. And I genuinely don't understand why this is such a problem in the US. But so we won't know what suicide actually is looking like in this period of time for probably 2 more years, which is awful, because I don't know how we as a society can actively prevent suicides if we are so delayed in actually seeing what the problem is. We have seen some, so I get Google alerts on firearm suicide every day. And I would say before COVID happened, I barely got any results because they don't often get reported to the media like a homicide would. So I wasn't getting as many. And since COVID started, I'm getting every day a notification of, honestly, a lot of law enforcement, specifically Black law enforcement. There's been many incidents of firearm suicides in that population. There's been a few examples of doctors. There was someone in New York, it was a first responder. I think it was an EMT as well. So we have that anecdotal data, and we have the CDC report saying that more people are considering suicide, but at least at the national level, we just don't have that data. There may be some like local jurisdictions that are tracking it better, but I am not familiar with any, unfortunately, which is a huge problem. And I know that CDC has said that they were going to track like excess deaths associated with COVID, but at least when I've been checking, I don't see suicide ever even mentioned. And I think something I learned, which is another big problem, is that how suicides are determined is different depending on every county and state across the US. And so even the data we have, we know is such an undercount, because in some places, they don't really even do an investigation. And so if there's not a note left, then a coroner or a medical examiner might just not report it as a suicide. Or if it's kind of there's a huge stigma and like a local community and the coroner or medical examiner knows someone, then they might not report it, which is another huge problem, why we need to, in addition to the firearms, address the stigma as well. Would it be safe to assume the suicide?
I had 2 things to follow up on that one.
Mm-hmm.
So we are tracking in real time all the deaths by suicide here in Wyoming at the Department of Health, but there's always going to be a lag time because different coroners finalize their reports and rule on cause of death during different time periods. So we always have, unresolved cases or undetermined cause of death. And so we can't give out, data as of today where we're at, because we have cases out there that haven't been finalized, but we have been watching it very closely, and we haven't seen as of yet a significant increase. So we're monitoring it, but I think you bring up a really great point about the need to decrease the stigma. I've had multiple calls from parents that have lost a child to suicide, and then they've been asked by the coroner as they're leaving the house, do you want me to rule this as an accident? Or, what would you like me to do? And that's a big issue. It's a big hurdle that we're going to have to overcome. And I think one of the only ways we can do that is to destigmatize death by suicide.
Yeah. I mean, this is my personal battle. Is even, I was looking through I have a Chase credit card, and I was trying to get reimbursed for something. And there was a whole section on what they won't reimburse for, like with travel. And it's if you are tending someone who had just died by suicide. And this is in a Chase bank. Like, you can get reimbursed for all of these things if your flight was canceled, but not if a suicide was involved at all. And so I think that just shows the like banana stigma that's in a credit card statement on how to get reimbursed for travel.
That's wild.
Yeah, I was shocked by that. I'm just trying to get my reimbursement for a missed flight, and then I found that. Wow, I just saw what Shelby wrote. Yeah, wow. I mean, the other part of like the coroner versus medical examiner is I believe in medical examiner, they have to be a doctor or medical
Yes,
person, and coroner can be elected, so they might not even have that medical training.
that is accurate. And in Wyoming, we do not currently have any medical examiners.
Oh,
We
wow.
only have coroners, and it is a locally elected county level position, and there's not a requirement that coroners have medical backgrounds. Some of them do, some of them do not.
Yeah. Ugh. Yeah, I think I mean, Shelby, what you just said is I mean, it's heartbreaking and it's frustrating from the data side because that's how so much funding goes into things, is seeing what places have more suicides. And so Congress, if we're not even knowing, the true scope of suicide in this country, Congress isn't giving any money to fight it, which is awful. And so it's just this loop of so many problems that need to be addressed. And I think the stigma is honestly one of the biggest things, because and this is like my personal fight, is making elected officials actually care about suicide prevention. Because again, especially right now, even if we don't see the suicide rate increase, we're still seeing all of these factors being increased at the same time. And so we need to be doing everything we can from both the upstream and downstream approaches to do suicide prevention, in my opinion.
Absolutely.
All right, well, it looks like we're almost at time. If people have any questions, again, my email is, I'll just put it one more time in the chat. Happy to answer any questions about firearm suicide prevention, anything of just general suicide prevention or questions. Happy, if I can be of help, please contact me at any time. And then Lindsay, I can send you the presentation just if people want to have that as well, because I know
Yeah,
in it.
absolutely. And I can post it on our website.
Oh, awesome. Okay, perfect. Thank you guys so much for having me.
You were wonderful. Thank you so much.
Thank you. Thank you so much. Have a great rest of your day, everyone. Stay
Bye.